Hey, Alpha Nurses, I'm Licensure from AlphaNurseGuide.com. This is 30 practice questions. Without the way, let's get started.
The intake nurse is making an assessment of a client who has just arrived at the emergency department. Which of the following comments from this client who is taking phenelzine, a monoamine oxidase inhibitor, for treatment-resistant depression should be given top priority? 1. My bowels haven't moved in the last 2 days. 2. What was my temperature? I'm feeling warm. 3. My legs feel stiff after I sit in the chair for a while. 4. I have a throbbing headache. The correct answer is for I have a throbbing headache. Rationale. A serious life-threatening reaction to MAO inhibitors is hypertensive crisis. Although this medication is inclined to reduce blood pressure, in combination with too much tyramine, blood pressure can rise to a dangerous level. A throbbing headache could be a significant indicator of an impending crisis. A nurse is educating a client who has been diagnosed with dysthymia about possible treatment for the disorder. Which response by the nurse is most appropriate? 1. Antidepressants, particularly the selective serotonin reuptake inhibitor, SSRI, group, offer you the best treatment for your dysthymia. 2. Doctors recommend that clients experiencing dysthymia receive electroconvulsive therapy, ECT, to treat their disorder. 3. Because you have a mild, though long-lasting dysthymic mood, psychotherapy can usually bring improvement with less likelihood of the need for medication. 4. Since your dysthymia indicates a long-lasting mild depression, long-term psychoanalysis would be the best treatment for you. The correct answer is 3. Because you have a mild, though long-lasting dysthymic mood, psychotherapy can usually bring improvement with less likelihood of the need for medication. Rationale. Dysthymia is a milder, persistent type of depression in which sufferers are able to minimally carry on their work. Antidepressant and ECT are treatments used for occurrences of major depression, with ECT being used as a last resort when several medications fail. Psychoanalysis is a very involved, long-term treatment rarely used now due to its cost and the long period of treatment required for results. A client diagnosed with major depression has sleep and appetite disturbances and a flat affect and is withdrawn. The client has been taking fluvoxamine Luvox, 50 milligrams twice daily for 5 days. Which client behavior is most important to report to the next shift? 1. Client's flat affect. 2. Clients interacting with a visitor. 3. Clients sleeping from 11 p.m. to 6 a.m. 4. Client spending the entire evening in her room. The correct answer is 3. Clients sleeping from 11 p.m. to 6 a.m. Rationale. The most important behavior to report to the next shift is that the client was able to sleep from 11 p.m. to 6 a.m. This indicates that improvement in the symptoms of depression is occurring as a result of pharmacologic therapy. The nurse would expect to observe improvement in sleep, appetite, and psychomotor behavior first before improvement in cognitive symptoms. The client's flat affect is still a symptom of depression. The fact that the client had a visitor is not as important as changes in the client's behavior. Spending the evening in her room is a continuation of the client's withdrawn behavior and is important to report, but not as important as the improvement in sleep. A client taking paroxetine, Paxil, 40 milligrams PO every morning tells the nurse that her mouth feels like cotton. Which of the following statements by the client necessitates further assessment by the nurse? 1. I'm sucking on ice chips. 2. I'm using sugarless gum. 3. I'm sucking on sugarless candy. 4. I'm drinking 12 glasses of water every day. The correct answer is 4. I'm drinking 12 glasses of water every day. Rationale. Dry mouth is a common, temporary side effect of paroxetine. The nurse needs to further assess the client's water intake when the client states she is drinking lots of water. Excessive intake of water could be harmful to the client and could lead to electrolyte imbalance. Dry mouth is caused by the medication, and drinking a lot of water will not eliminate it. Sucking on ice chips or using sugarless gum or candy is appropriate to ease the discomfort of dry mouth associated with paroxetine. A client taking mirtazapine is disheartened about a 20 pounds, 9 kilograms, Weight gain over the past 3 months. The client tells the nurse, I stopped taking my mirtazapine 15 days ago. I don't want to get depressed again, but I feel awful about my weight. Which response by the nurse is most appropriate? 1. Focusing on diet and exercise alone should control your weight. 2. Your depression is much better now, so your medication is helping you. 3. Look at all the positive things that have happened to you since you started mirtazapine. 4. I hear how difficult this is for you and will help you approach the doctor about it. The correct answer is 4. I hear how difficult this is for you and will help you approach the doctor about it. Rationale. The nurse should express concern for the client and offer to help the client speak with the primary healthcare provider, which will lend support to the client's concerns. The client who has stopped the medication must be taken seriously because medication noncompliance could result in a recurrence of symptoms of depression. Telling the client to focus on diet and exercise ignores the client's feelings and subtly implies the weight gain is the client's fault. Pointing out that the medication has helped and that positive things have happened since the depression lifted may be true, but it does not address the client's current feelings or needs. A client with depression who is taking doxepin, Sinequin, 100 milligrams PO, at bedtime has dizziness on arising. Which of the following suggestions is most appropriate? 1. Try taking a hot shower. 2. Get up slowly and dangle your feet before standing. 3. Stay in bed until you are feeling better. 4. You need to limit the fluids you drink. The correct answer is 2. Get up slowly and dangle your feet before standing. Rationale. Doxepin and other tricyclic antidepressants may cause postural hypotension, especially in the morning. Postural hypotension occurs because the tricyclic antidepressant inhibits the body's natural vasoconstrictive reaction when a person stands. The nurse regularly monitors the client's vital signs, both lying and standing. The nurse should instruct the client to rise slowly and dangle his feet before standing. Advising the client to take a hot shower is detrimental to the client's safety. Heat causes vasodilation, which could further exacerbate the dizziness, placing the client at risk for falls and subsequent injury. Telling the client to stay in bed until he is feeling better is not helpful and is impractical. The client with depression would rather stay in bed and withdraw from others. Placing the client on fluid restriction is detrimental to the client with depression whose fluid and food intake may be inadequate. The client with depression who is taking imipramine, tofranil, states to the nurse, my doctor wants me to have an electrocardiogram in 2 weeks, but my heart is fine. Which response by the nurse is most appropriate? 1. It's routine practice to have ECGs periodically because there is a slight chance that the drug may affect the heart. 2. It's probably a precautionary measure because I'm not aware that you have a cardiac condition. 3. Try not to worry too much about this. Your doctor is just being very thorough in monitoring your condition. 4. You had an ECG before you were prescribed imipramine, and the procedure will be the same. The correct answer is 1. It's routine practice to have ECGs periodically because there is a slight chance that the drug may affect the heart. Rationale. Telling the client that ECGs are done routinely for all clients taking imipramine, a tricyclic antidepressant, is an honest and direct response. Additionally, it provides some reassurance for the client. Commonly, a client with depression will ruminate, leading to needless increased anxiety. Tricyclic antidepressants may cause tachycardia, ECG changes, and cardiotoxicity. Telling the client that it's probably a precautionary measure because the nurse is not aware of a cardiac condition instills doubt and may cause undue anxiety for the client. Telling the client not to worry because the doctor is very thorough dismisses the client's concern and does not give the client adequate information. Explaining that the client had an ECG before initiating therapy with imipramine and that the procedure will be the same does not answer the client's question. Which of the following outcomes should the nurse include in the initial plan of care for a client who is exhibiting psychomotor retardation, withdrawal, minimal eye contact, and unresponsiveness to the nurse's questions? 1. The client will initiate interactions with peers. 2. The client will participate in milieu activities. 3. The client will discuss adaptive coping techniques. 4. The client will interact with the nurse. The correct answer is 4. The client will interact with the nurse. Rationale. In the initial plan of care, the most appropriate outcome would be that the client will interact with the nurse. First, the client would begin interacting with one individual, the nurse. The nurse would gradually assist the client to engage in interactions with other clients in one-on-one contacts, progressing toward informal group gatherings and eventually taking part in structured group activities. The client needs to experience success according to the client's level of tolerance. Initiating interactions with peers occurs when the client can gain a measure of confidence and self-esteem instead of feeling intimidated or unduly anxious. Discussing adaptive coping techniques is an outcome the client may be able to reach when symptoms are not as severe and the client can concentrate on improving coping skills. After administering a prescribed medication to a client who becomes restless at night and has difficulty falling asleep, which of the following nursing actions is most appropriate? 1. Sitting quietly with the client at the bedside until the medication takes effect. 2. Engaging the client in interaction until the client falls asleep. 3. Reading to the client with the lights turned down low. 4. Encouraging the client to watch television until the client feels sleepy. The correct answer is 1. Sitting quietly with the client at the bedside until the medication takes effect. Rationale. To promote adequate rest, 6 to 8 hours per night, and to eliminate hypersomnia, the nurse should sit with the client at the bedside until the medication takes effect. The presence of a caring nurse provides the client with comfort and security and helps to decrease the client's anxiety. Engaging the client in interaction until the client falls asleep, reading to the client, or encouraging the client to watch television may be too stimulating for the client, consequently increasing rather than decreasing the client's restlessness. A client is taking phenelzine, Nardil, 15 milligrams PO, 3 times a day. The nurse is about to administer the 1 p.m. dose when the client tells the nurse about having a throbbing headache. Which of the following should the nurse do first? 1. Give the client an analgesic, prescribed PRN. 2. Call the primary healthcare provider to report the symptom. 3. Administer the client's next dose of phenelzine. 4. Obtain the client's vital signs. The correct answer is 4. Obtain the client's vital signs. Rationale. The nurse should first take the client's vital signs because the client could be experiencing a hypertensive crisis, which requires prompt intervention. Signs and symptoms of a hypertensive crisis include occipital headache, a stiff or sore neck, nausea, vomiting, sweating, dilated pupils and photophobia, nosebleed, tachycardia, bradycardia, and constricting chest pain. Giving this client an analgesic without taking his vital signs first is inappropriate. After the client's vital signs have been obtained, then the nurse would call the primary healthcare provider to report the client's problems and vital signs. Administering the client's next dose of phenelzine for taking his vital signs could result in a dangerous situation if the client is experiencing a hypertensive crisis. The client states to the nurse, "I take citalopram, Celexa, 40 milligrams every day as my primary healthcare provider prescribed. I have also been taking St. John's wort 750 milligrams daily for the past 2 weeks." Which of the following indicate that the client is developing serotonin syndrome? Select all that apply. 1. Confusion. 2. Restlessness. 3. Constipation. 4. Diaphoresis. 5. Ataxia. The correct answers are 1. Confusion, 2. Restlessness, 4. Diaphoresis, and 5. Ataxia. Rationale. Serotonin syndrome can occur if a selective serotonin reuptake inhibitor is combined with a monoamine oxidase inhibitor, a tryptophan serotonin precursor, or St. John's wort. Signs and symptoms of serotonin syndrome include mental status changes, such as confusion, restlessness or agitation, headache, diaphoresis, ataxia, myoclonus, shivering, tremor, diarrhea, nausea, abdominal cramps, and hyperreflexia. Constipation is not associated with serotonin syndrome. A client with major depression is to be discharged home tomorrow. When preparing the client's discharge plan, which of the following areas is most important for the nurse to review with the client? 1. Future plans for going back to work. 2. A conflict encountered with another client. 3. Results of psychological testing. 4. Medication management with outpatient follow-up. The correct answer is 4. Medication management with outpatient follow-up. Rationale. Medication management with outpatient follow-up is of vital importance to discuss with the client before discharge. The nurse teaches and clarifies any questions related to medication and outpatient treatment. The client also has the opportunity to voice feelings related to medication and treatment. The goal is to assist the client in making a successful transition from hospital to home with optimal functioning outside the hospital for as long as possible. The nurse may also need to assist with decreasing any anxiety the client may have related to discharge. Discussing future plans for returning to work or employment is not as immediate a concern as assisting with medication and treatment compliance. Noncompliance with medication is a primary cause of relapse in a client with a psychiatric disorder. Reviewing a conflict the client had encountered with another client is not appropriate or therapeutic at this time unless the client brings it to the nurse's attention. The conflict should have been dealt with and resolved when it occurred. Reviewing the results of psychological testing is the responsibility of the primary healthcare provider if he chooses. When developing the teaching plan for the family of a client with severe depression who is to receive electroconvulsive therapy, ECT, which of the following information should the nurse include? 1. Some temporary confusion and disorientation immediately after treatment is common. 2. During an ECT treatment session, the client is at risk for aspiration. 3. Clients with severe depression usually do not respond to ECT. 4. The client will not be able to breathe independently during a treatment. The correct answer is 1. Some temporary confusion and disorientation immediately after a treatment is common. Rationale. The family needs to be informed that some confusion and disorientation will occur as the client emerges from anesthesia immediately after ECT to lessen their fear and anxiety about the procedure. The nurse will assist the client with reorientation and will give clear, simple instructions. The client may need to lie down after ECT because of the effects of the anesthesia. Informing the family that there is a danger of aspiration during ECT is inappropriate and unnecessary. The risk of aspiration occurring during ECT is minimal because food and fluids are withheld for 6 to 8 hours before the treatment. In addition, the client receives atropine to inhibit salivation and respiratory tract secretions. Telling the family that the client will not be able to breathe independently during ECT may frighten them unnecessarily. If asked, the nurse should inform the family that the anesthesiologist mechanically ventilates the client with 100% oxygen immediately before the treatment. The client with severe depression responds to ECT. Usually, ECT is used for those who are severely depressed and not responding to pharmacotherapy. During a group session, a client who is depressed tells the group that he lost his job. Which of the following responses by the nurse is best? 1. It must have been very upsetting for you. 2. Would you tell us about your job? 3. You'll find another job when you're better. 4. You were probably too depressed to work. The correct answer is 1. It must have been very upsetting for you. Rationale. By stating it must have been very upsetting for you, the nurse conveys empathy to the client by recognizing the underlying meaning of a painful occurrence. The nurse's statement invites the client to verbalize feelings and thoughts and lets the client know that the nurse is listening to and respects the client. Telling the client to talk about the job disregards the client's feelings and is non-therapeutic for the depressed client because of underlying feelings of worthlessness and guilt that are commonly present. Telling the client that he will find another job when he is better or that he was probably too depressed to work is inappropriate because it disregards the client's feelings and may promote additional feelings of failure and inadequacy in the client. Which of the following statements by a client taking trazodone deserel, as prescribed by the primary healthcare provider, indicates to the nurse that further teaching about the medication is needed? 1. I will continue to take my medication after a light snack. 2. Taking deserel at night will help me to sleep. 3. My depression will be gone in about 5 to 7 days. 4. I won't drink alcohol while taking Deserel. The correct answer is 3. My depression will be gone in about 5 to 7 days. Rationale. Symptom relief can occur during the first week of therapy, with optimal effects possible within 2 weeks. For some clients, 2 to 4 weeks is needed for optimal effects. The client statement that the depression will be gone in 5 to 7 days indicates to the nurse that clarification and further teaching is needed. Trazodone should be taken after a meal or light snack to enhance its absorption. Trazodone can cause drowsiness, and therefore the major portion of the drug should be taken at bedtime. The depressant effects of central nervous system depressants and alcohol may be potentiated by this drug. Which of the following statements made by an adolescent who has just begun taking an antidepressant would indicate the need for further teaching about the action of antidepressants in treating depression? 1. Now that I've been taking my antidepressant for a week, I'm going to feel better about myself. 2. A week ago when I started my antidepressant, I didn't care about eating, but now I want to eat a bit more. 3. After a week of taking my antidepressant, I can sleep a little better, 6 hours or so each night. 4. Now that I've had a week of my antidepressant, it is a little easier to get up in the morning. The correct answer is 1. Now that I have been taking my antidepressant for a week, I'm going to feel better about myself. Rationale. In the first week or so of taking an antidepressant, the vegetative symptoms of depression such as poor sleep, appetite, and energy level improve. However, it takes 3 to 4 weeks for improvement in self-concept/self-esteem to take place. A client comes to the mental health clinic for a follow-up visit for a diagnosis of major depressive disorder. He says that he has been taking his escitalopram oxalate as prescribed since his second hospitalization 3 months ago. He tells the nurse that he is feeling like my old self again. Now he wants to stop taking medication. I don't want to be dependent on meds like my father. What is the nurse's best initial response to him? 1. After another 3 months of stability, it might be safe for you to go off the escitalopram. 2. After 2 significant episodes, you will need to take an antidepressant indefinitely. 3. Research indicates that individuals who have had 2 major depressive episodes have a 70% chance of having a third episode. 4. It is likely that you can learn to manage your depression with a regular exercise regime and a healthy diet. The correct answer is 3. Research indicates that individuals who have had 2 major depressive episodes have a 70% chance of having a third episode. Rationale. After 2 episodes of a major depressive disorder, the likelihood of a third episode increases to 70%. This information would be useful to convey prior to discussing the importance of continuing his medication. This client also has a family history of depression. A healthy diet and exercise are very significant adjuncts to the therapeutic plan, but may not be sufficient as standalone therapy. A client with major depressive disorder has independently showered, dressed, and washed her hair for the first time since her admission to the inpatient unit 4 days ago. In an interaction with the nurse, she still stresses her faults. She states, "I'm just no good. I can't do anything right." The nurse's best response would be 1. You look very nice today. 2. You were able to shower, wash your hair, and dress today. 3. I'll get out the craft project that you wanted to complete. 4. What is your goal for today? The correct answer is 2. You were able to shower, wash your hair, and dress today. Rationale. An objective reflection by the nurse based on actual behavior is the best affirmation for the client to help boost self-esteem. Depressed persons tend to reject positive opinions from others. Picking a project for such a client is also likely to bring a negative response and/or foster dependence. Antipsychotics are sometimes prescribed for clients with bipolar disorder and would not pose a special concern. The client with depression has been consistent with taking 12.5 milligrams of paroxetine, Paxil, extended release daily. The nurse judges the client to be benefiting from this drug therapy when the client demonstrates which of the following behaviors? Select all that apply. 1. Takes 2-hour evening naps daily. 2. Completes homework assignments. 3. Decreases pacing. 4. Increases somatization. 5. verbalizes feelings. The correct answers are 2. Completes homework assignments, 3. Decreases pacing, and 5. Verbalizes feelings. Rationale. Symptoms of depression include depressed mood, appetite disturbance, sleep disturbance, psychomotor disturbance, fatigue, feelings of worthlessness, excessive or inappropriate guilt, and decreased concentration. Paroxetine is a selective serotonin reuptake inhibitor antidepressant that also can be used to treat anxiety. Improved concentration, verbalization of feelings, and decreased agitation or pacing are signs of improvement. Taking 2-hour evening naps daily is still a sign of fatigue or lack of energy, and the increased use of somatization could be signs of continued symptoms of depression. When developing a teaching plan for a client about the medications prescribed for depression, which of the following components is most important for the nurse to include? 1. Pharmacokinetics of the medication. 2. Current research related to the medication. 3. Management of common adverse effects. 4. Dosage regulation and adjustment. The correct answer is 3. Management of common adverse effects. Rationale. Compliance with medication therapy is crucial for the client with depression. Medication noncompliance is the primary cause of relapse among psychiatric clients. Therefore, the nurse needs to teach the client about managing common adverse effects to promote compliance with medication. Teaching the client about the medication's pharmacokinetics may help the client to understand the reason for the drug. However, teaching about how to manage common adverse effects to promote compliance is crucial. Current research about the medication is more important to the nurse than to the client. Teaching about dosage regulation and adjustment of medication may be helpful, but typically the primary healthcare provider, not the client, is the person in charge of this aspect. The primary healthcare provider prescribes mirtazapine, Remeron, 30 milligrams PO at bedtime for a client diagnosed with depression. The nurse should 1. Give the medication as prescribed. 2. Question the primary healthcare provider's prescription. 3. Request to give the medication in the morning. 4. Give the medication in 3 divided doses. The correct answer is 1. Give the medication as prescribed. Rationale. The nurse should give the medication as prescribed. Mirtazapine is given once daily, preferably at bedtime, to minimize the risk of injury resulting from postural hypotension and sedative effects. The usual dosage ranges from 15 to 45 milligrams. There is no reason to question the primary healthcare provider's prescriptions. The nurse should administer the medication as prescribed. Requesting to give the medication in 3 divided doses is inappropriate and demonstrates the nurse's lack of knowledge about the drug. When assessing a client who is receiving tricyclic antidepressant therapy, which of the following should alert the nurse to the possibility that the client is experiencing anticholinergic effects? 1. Tremors and cardiac arrhythmias. 2. Sedation and delirium. 3. Respiratory depression and convulsions. 4. Urine retention and blurred vision. The correct answer is 4. Urine retention and blurred vision. Rationale. Anticholinergic effects, which result from blockage of the parasympathetic nervous system, include urine retention, blurred vision, dry mouth, and constipation. Tremors and cardiac arrhythmias are possible side effects, but they are caused by increased norepinephrine availability. Sedation and delirium are not anticholinergic effects. Sedation may be a therapeutic effect because many clients with depression experience agitation and insomnia. Delirium, typically not a side effect, would indicate toxicity, especially in elderly clients. Respiratory depression, convulsions, ataxia, agitation, stupor, and coma indicate tricyclic antidepressant toxicity. When preparing a teaching plan for a client about imipramine, tofranil, which of the following substances should the nurse tell the client to avoid while taking the medication? 1. Caffeinated coffee. 2. Sunscreen. 3. Alcohol. 4. Artificial tears. The correct answer is 3. Alcohol. Rationale. Imipramine, A tricyclic antidepressant in combination with alcohol will produce additive central nervous system depression. Although caffeinated coffee is safe to use when the client is taking imipramine, it is not recommended for a client with depression who may be experiencing sleep disturbances. Imipramine may cause photosensitivity, so the client would be instructed to use sunscreen and protective clothing when exposed to the sun. Reduced lacrimation may occur as a side effect of imipramine. Therefore, the use of artificial tears may be recommended. Which of the following behaviors exhibited by a client with depression should lead the nurse to determine that the client is ready for discharge? 1. Interactions with staff and peers. 2. Sleeping for 4 hours in the afternoon and 4 hours at night. 3. Verbalization of feeling in control of self and situations. 4. Statements of dissatisfaction over not being able to perform at work. The correct answer is 3. Verbalization of feeling in control of self and situations. Rationale. The client who verbalizes feeling in control of self and situations no longer feels powerless to affect an outcome, but realizes that one's actions can have an impact on self and situations. It is common for the client with depression to feel powerless to affect an outcome and to feel a lack of control over a situation. Although interacting with staff and peers is a positive action, the client could be conversing in a negative or non-therapeutic manner. Sleeping 4 hours in the afternoon and 4 hours at night is evidence of symptomatology and does not indicate improvement or recovery. Verbalizing dissatisfaction over not being able to perform at work indicates that the client is most likely focusing on shortcomings and powerlessness. A female client with severe depression and weight loss has not eaten since admission to the hospital 2 days ago. Which of the following approaches should the nurse include when developing this client's plan of care to ensure that she eats? 1. Serving the client her meal trays in her room. 2. Sitting with the client and spoon feeding if required. 3. Calling the family to bring the client food from home. 4. Explaining the importance of nutrition in recovery. The correct answer is 2. Sitting with the client and spoon feeding if required. Rationale. A depressed client commonly is not interested in eating because of the psychopathology of the disorder. Therefore, the nurse must take responsibility to ensure that the client eats, including spoon feeding the client if necessary. Serving the client her tray in her room does not ensure that she will eat. Calling the family to bring the client food from home usually is allowed, but it is still the nurse's responsibility to ensure that the client eats. Explaining the importance of nutrition in recovery is not helpful. The client may intellectually know that eating is important, but may not be interested in eating or want to eat. When teaching the client with atypical depression about foods to avoid while taking phenelzine, which of the following should the nurse include? 1. Roasted chicken. 2. Salami. 3. Fresh fish. 4. Hamburger. The correct answer is 2. Salami. Rationale. Phenelzine is a monoamine oxidase inhibitor. MAOIs block the enzyme monoamine oxidase, which is involved in the decomposition and inactivation of norepinephrine, serotonin, dopamine, and tyramine. Foods high in tyramine. Those that are fermented, pickled, aged, or smoked must be avoided because when they are ingested in combination with MAOIs, a hypertensive crisis occurs. Some examples include salami, bologna, dried fish, sour cream, yogurt, aged cheese, bananas, pickled herring, caffeinated beverages, chocolate, licorice, beer, red wine, and alcohol-free beer. The client who has been taking venlafaxine Effexor 25 milligrams PO 3 times a day for the past 2 days states, "This medicine isn't doing me any good. I'm still so depressed." Which of the following responses by the nurse is most appropriate? 1. Perhaps we'll need to increase your dose. 2. Let's wait a few days and see how you feel. 3. It takes about 2 to 4 weeks to receive the full effects. 4. It's too soon to tell if your medication will help you. The correct answer is 3. It takes about 2 to 4 weeks to receive the full effects. Rationale. The client needs to be informed of the time lag involved with antidepressant therapy. Although improvement in the client's symptoms will occur gradually over the course of 1 to 2 weeks, typically it takes 2 to 4 weeks to get the full effects of the medication. This information will help the client be compliant with medication and will also help in decreasing any anxiety the client has about not feeling better. The client's dose may not need to be increased. It is too early to determine the full effectiveness of the drug. Additionally, such a statement may increase the client's anxiety and diminish self-worth. Telling the client to wait a few days discounts the client's feelings and is inappropriate. Although it is too soon to tell whether the medication will be effective, telling this to the client may cause the client undue distress. This statement is somewhat negative because it is possible that the medication will not be effective, possibly further compounding the client's anxiety about not feeling better. The client with recurring depression will be discharged from the psychiatric unit. Which suggestion to the family is best to help them prepare for the client's return home? 1. Discourage visitors while the client is at home. 2. Provide for a schedule of activities outside the home. 3. Involve the client in usual at-home activities. 4. Encourage the client to sleep as much as possible. The correct answer is 3. Involve the client in usual at-home activities. Rationale. It is best to involve the client in usual at-home activities as much as the client can tolerate them. Discouraging visitors may not be in the client's best interest because visits with supportive significant others will help reinforce supportive relationships, which are important to the client's self-worth and self-esteem. Providing for a schedule of activities outside the home may be overwhelming for the client initially. Involving the client in planning for outside activities would be appropriate. Encouraging the client to sleep as much as possible is non-therapeutic and promotes withdrawal from others. A male client who is very depressed exhibits psychomotor retardation, a flat affect, and apathy. The nurse observes the client to be in need of grooming and hygiene. Which of the following nursing actions is most appropriate? 1. Explaining the importance of hygiene to the client. 2. Asking the client if he is ready to shower. 3. Waiting until the client's family can participate in the client's care. 4. Stating to the client that it's time for him to take a shower. The correct answer is 4. Stating to the client that it's time for him to take a shower. Rationale. The client with depression is preoccupied, has decreased energy, and cannot make decisions, even simple ones. Therefore, the nurse presents the situation, it's time for a shower, and assists the client with personal hygiene to preserve his dignity and self-esteem. Explaining the importance of good hygiene to the client is inappropriate because the client may know the benefits of hygiene, but is too fatigued and preoccupied to pay attention to self-care. Asking the client if he is ready for a shower is not helpful because the client with depression commonly cannot make even simple decisions. This action also reinforces the client's feeling about not caring about showering. Waiting for the family to visit to help with the client's hygiene is inappropriate and irresponsible on the part of the nurse. The nurse is responsible for making basic decisions for the client until the client can make decisions for himself. A 62-year-old female client with severe depression and psychotic symptoms is scheduled for electroconvulsive therapy tomorrow morning. The client's daughter asks the nurse, "How painful will the treatment be for mom?" The nurse should respond by saying which of the following? 1. Your mother will be given something for pain before the treatment. 2. The primary healthcare provider will make sure your mother doesn't suffer needlessly. 3. Your mother will be asleep during the treatment and will not be in pain. 4. Your mother will be able to talk to us and tell us if she's in pain. The correct answer is 3. Your mother will be asleep during the treatment and will not be in pain. Rationale. The nurse should explain that ECT is a safe treatment and that the client is given an ultra-short-acting anesthetic to induce sleep before ECT and a muscle relaxant to prevent musculoskeletal complications during the convulsion, which typically lasts 30 to 60 seconds to be therapeutic. Atropine is given before ECT to inhibit salivation and respiratory tract secretions and thereby minimize the risk of aspiration. Medication for pain is not necessary and is not given before or during the treatment. Some clients experience a headache after the treatment and may request and be given an analgesic such as acetaminophen. Telling the daughter that the primary healthcare provider will ensure that the client does not suffer needlessly would not provide accurate information about ECT. This statement also implies that the client will have pain during the treatment, which is untrue.
You can get my NCLEX course review. Links will be in the description. I'll see you guys in the next video.